Understanding the safe use of medications goes beyond just knowing the basics. It is a vital aspect of our lives and health. Medications are potent tools intended to combat diseases, manage chronic conditions, and elevate our life's quality. However, these very tools can bring about significant risks if misused. Education and awareness therefore become our strongest armor against these potential hazards. Misinterpreting dosage instructions or combining medications without proper medical guidance are common errors that can lead to grave, sometimes fatal outcomes. A lapse in awareness can result in misuse, overuse, and accidental overdosing. Thus, it is absolutely critical for us to grasp the significance of medication safety. This entails knowing how to use, store, and dispose of medications, and being vigilant of potential interactions and side effects. Today, our discussion will pivot more on the general safety measures one should take while using any medication. But before we proceed, we would like to remind you to subscribe to our channel, like this video, and join the Medicine Health 360 community. By doing so, you'll not only support us in raising public awareness about crucial health-related topics, but also arm yourself with valuable information that can potentially save lives. Acetaminophen, also known as Tylenol or Paracetamol, is a common over-the-counter medication used to relieve pain and reduce fever. It's a staple in many medicine cabinets with its ability to ease everything from a throbbing headache to a high body temperature. But what exactly is acetaminophen? In essence, it's a drug that works by changing the way our bodies perceive pain and by cooling the body down when it's overheated. It's available in various forms from tablets and capsules to liquids and drops, making it versatile for different needs and age groups. Despite its widespread use and availability, it's crucial to understand that acetaminophen isn't a medication to be taken lightly. Like any drug, it must be used properly to ensure its effectiveness and to avoid potential risks. Misuse or overuse can lead to serious health issues. So what are the safety considerations when taking this medication? Taking acetaminophen safely involves several considerations. Let's dive into these key safety points, starting with dosage guidelines. It's imperative to follow the recommended dosage on the product label, or as directed by a healthcare professional. Going over the maximum daily dose can lead to liver damage. Next, consider your alcohol intake. Acetaminophen and alcohol can be a dangerous mix, potentially increasing the risk of liver damage. So, while you're taking acetaminophen, it's wise to limit or avoid alcohol. You should also be aware of combination products. Acetaminophen is often included in other medications, like cold and flu remedies or prescription pain relievers. Always check the labels to prevent unintentional overdose. Another consideration is the interaction with other medications. Some drugs may react with acetaminophen, so it's important to inform your healthcare provider about all the medications, including over-the-counter drugs and herbal supplements you're currently taking. Liver health is another significant aspect. Acetaminophen can affect the liver, so if you have liver disease or other liver conditions, it's crucial to consult with a healthcare professional before taking acetaminophen. If you're pregnant or breastfeeding, remember that acetaminophen is generally considered safe when used as directed. Still, it's advisable to consult with a healthcare provider, especially if you're anticipating higher doses or prolonged use. For children, use age-appropriate formulations and adhere to the dosing guidelines. Never give adult formulations to children unless directed by a healthcare professional. Chronic use of acetaminophen should be under the guidance of a healthcare provider. Even when taken within recommended doses, long-term use may have implications for liver health. Always stay vigilant for signs of an allergic reaction like rash, itching, or swelling, and seek medical attention if any adverse reactions occur. In case of an overdose, symptoms of which may include nausea, vomiting, loss of appetite, confusion, or unusual tiredness, seek emergency medical attention immediately. Finally, store acetaminophen at room temperature, away from moisture and heat, and out of the reach of children. These considerations are not just recommendations, they are vital steps to ensure your health and safety. There are certain situations that require special attention when taking acetaminophen. First, let's consider pregnancy and breastfeeding. Acetaminophen is generally safe during these periods when used as directed. However, it's always best to consult with a healthcare provider, especially if you anticipate needing higher doses or prolonged use. This ensures the maximum safety for both mother and child. Moving on to children, they must be given age-appropriate formulations of acetaminophen. The dosing guidelines for children are different from adults, and giving them adult formulations could lead to serious complications. Always follow the guidelines provided on the product or as directed by a healthcare professional. Now let's talk about chronic use. Long-term or chronic use of acetaminophen, even within the recommended doses, could have implications for liver health. The liver is responsible for metabolizing acetaminophen, and excessive use could lead to liver damage. Therefore, if you need to use acetaminophen for a prolonged period, do so under the guidance of a healthcare provider. In all these scenarios, the key is to be mindful and cautious. Keep track of the dosage, duration, and any potential side effects. And remember, acetaminophen is often an ingredient in other medications, so always check labels to avoid unintentional overdosing. Remember, when in doubt, always consult with a healthcare professional. Your health and safety are paramount, and healthcare professionals are there to guide you through the safe use of medications like acetaminophen. Being vigilant for side effects and seeking professional advice are integral parts of medication safety. Let's delve into why this is so crucial. Monitoring for side effects is the first line of defense in ensuring your body is reacting appropriately to the medication. Acetaminophen, like any other drug, can cause adverse reactions. Symptoms such as rash, itching, or swelling may indicate an allergic reaction. More severe signs like nausea, vomiting, loss of appetite, confusion, or unusual tiredness could suggest an overdose. In such instances, it's imperative to seek emergency medical attention immediately. An overdose is not merely about taking more than the recommended dose at once. It can also occur if you take a little too much over a prolonged period. Safe medication use also involves a proactive approach. This includes consulting with a healthcare professional if there are any uncertainties or concerns. Whether you have pre-existing medical conditions, are taking other medications, or are simply unsure about the dosage, don't hesitate to ask questions. Remember that acetaminophen is often an ingredient in combination medications, so you might be taking more than you think. Inform your healthcare provider about all the medications you're on, even over-the-counter ones, to avoid unintentional overdose. And let's not forget about storage. Keeping acetaminophen at room temperature, away from moisture and heat, and out of reach of children, contributes to its safe use. Remember, taking medications safely is a crucial part of maintaining your health. Always be informed, vigilant, and proactive when it comes to your health. Medicine is a powerful tool in maintaining and improving health, but like any tool, it needs to be used correctly. Here, we'll discuss some common mistakes people make when using acetaminophen and how to avoid them. First, avoid the more is better mentality. Acetaminophen is effective, but taking more than the recommended dose will not speed up your recovery. In fact, it may lead to serious health issues like liver damage. Always stick to the recommended dose unless instructed otherwise by a healthcare professional. Second, never mix medications without consulting a healthcare professional. As we've mentioned before, acetaminophen is often an ingredient in other medications. Taking multiple medications containing acetaminophen can lead to unintentional overdose. Third, don't ignore the instructions on the label. They are there for your safety. This includes instructions on how often to take the medication, what to do if you miss a dose, and what substances to avoid while taking the medication. Lastly, don't be afraid to ask questions. If you're unsure about anything related to your medication, consult a healthcare professional. They can provide you with accurate information and help you avoid common medication mistakes. Remember, being informed and vigilant is the key to safe medication use. So, let's continue to learn and take care of our health together.